Hi everyone, welcome to our Gender Equality Research Network seminar. We've been really lucky this month to have two on consecutive Fridays. Today, I'm so delighted to introduce two individuals who I know quite well, and so that makes it really lovely. So I know I can speak with knowledge about the research that they're doing, and of course that part of the opportunity of the Gender Equality Research Network is for all of you to get to know each other's work as well. So, and I hope you're finding it a really worthwhile exercise at the moment. So I'd like to acknowledge the lands of the Turrbal people on which I am standing or sitting here today, and pay my respects to their elders past and present and emerging. And I know that it's also important that we pay our respects to all of their Indigenous communities on the lands upon which we are all gathering today. So, as I said, today we've got two presentations that we are going to be going through. The first one is going to be from Molly Dragiewicz. And Molly is an internationally award-winning criminologist who studies violence and gender. She's researching technology-facilitated coercive control and domestic violence in the context of post-separation parenting. Molly's been involved in interdisciplinary, applied, collaborative research with community organisations working to end violence against women. She serves on the board of Queensland Domestic and Family Violence Death Review Unit and is a steering committee member for the Family Law Pathways Network Gold Coast. Molly here today is to talk about technology and domestic violence and the role of technology in domestic violence. And she's going to present her findings from recent research on the technologies and types of abuse involved, and also the misconceptions about how to respond to technology-facilitated abuse and recommendations for prevention. I will then introduce our second speaker, Outi Donovan, after Molly has spoken. So as I said, the usual framework applies. Molly will speak. If you've got any questions, feel free to post them in the comments box or just ask question and I'll call you up after Molly has spoken. Thanks so much, Molly.
Okay, let's attempt sharing. Can you see the first slide there?
Yes.
Yay. All right, it's a miracle. Just by the by, if there's any HDR students here today, the Family Law Pathways Network Gold Coast is actually hiring a 15-hour fixed-term position. So if you're looking for a little bit of work, I can share that link after I'm done talking. It's a really interesting group to be part of. So today I'm here to talk about domestic violence and communication technology, and let's just get going because I only have 15 minutes. So first, I'd like to acknowledge all the traditional owners, past, present, and emerging, of all of the Indigenous, Aboriginal, and Torres Strait Islander people on the campus where I would normally be based, and all the other campuses where we're scattered all around at the moment, and especially to any Aboriginal and Torres Strait Islander people that are in attendance today. Okay, so the research that I'm talking about today was funded by a grant from ACAN. And I think I have a slide about that at the end. So I'll tell you more about that funding, which may be a good option for HDR students and professors working at Griffith. So like all or most research projects, I guess I should say, this work would not have been possible without a ginormous team. So this is the huge research team that we worked with on this project. A number of HDR students and practitioners helped us out with this research, as well as professors from a number of universities. The parts of the study that I'm talking about today are the interview parts of this ACAN study that we did. So these findings are based on interviews with 20 survivors, 10 in Queensland and 10 in New South Wales. And as you can see from this little map, we had quite a diverse group of participants, with 10 being born in Australia and 10 being born in other countries, really spread across the globe. So that was really interesting. Okay, just to get right into it, because we have 15 minutes today. Sometimes there's a misconception that a lot of the technology-facilitated abuse is completed by abusers that have a high level of technology skills and that they're doing hacking that's, we might imagine that as sort of high-tech, skilled labor to stalk and harass people. But in fact, we found that the most common types of abuse are the technologies that we use most often. So Facebook, lots of us are on Facebook nowadays, and accordingly, that was the most common, one of the most common places that technology facilitated abuse takes place. Over email, just the email written version of what might be considered to be verbal or psychological abuse and threats. But here's some other places where you might not think of when you think about technology facilitated abuse. Quite a bit of the stalking and unauthorized access to accounts that our survivors experienced was via cloud-based storage. So this might be the iCloud if you have a Mac phone or computer or Apple phone, or it might be your Google accounts that are shared on a cloud and stored on a cloud. Any data that's shared on a cloud, Dropbox, anything, that is a really easy way for abusers to get unauthorized access, especially if you're exchanging children back and forth that have devices that may be logged in at one house and remain logged in when they transfer to the other home, or if the abuser has access, physical access to your devices and machines at your home because you still live together, or they have access to the home where they've broken in, or you simply haven't remembered all of the accounts that you have. Also, GPS data is a really important part of technology facilitated abuse. It simply makes stalking so easy for abusers. They used to have to drive back and forth in front of your house 20 times a day or attend your workplace. But a lot of abusers use GPS-enabled apps of all kinds, fitness trackers, mapping. Google records all of your movements on GPS unless you have the settings otherwise, and use that to very easily stalk you from wherever they're located. Also, of course, text messages, an increasing place that we communicate, was very common location for verbal abuse and threats. In our study, we recruited for women who were survivors of domestic and family violence, and we were open to same-sex couples, but in our sample, 100% of the participants' abusers were male. So some key Australian survivor experiences. One important dynamic is that technology facilitated abuse increases at separation. And this is one of the misconceptions that, if the partners simply separate, their toxic relationship will be over and the domestic violence will be solved. Well, in fact, technology facilitated abuse increased for 100% of the survivors in our sample. So 100% of the survivors in our sample who were abused by an intimate partner reported that the technology facilitated abuse either began or escalated at separation. So that's a key context for thinking about technology facilitated abuse, that pre and post separation, but being aware of that increase post separation. Along with that, we have the context of post separation parenting. That's a very important central context for technology facilitated abuse for domestic violence survivors. So in our sample, 14 of our survivors had kids, and 13 of those 14 women reported technology facilitated abuse in the context of post-separation parenting. So this could include communicating about the children or ostensibly about the children or via the children's devices, or involved using devices or children to contact the other partner. So very significant there, 93% of our small sample experienced tech facilitated abuse in the context of post-separation parenting. And this is a really important context for family law practitioners to be aware of. So overall, the impact of technology facilitated abuse, we've got a paper coming out on this shortly, but although some practitioners and police officers and courts don't understand that non-physical types of abuse are extremely harmful, technology facilitated abuse, which is by nature not the physical stuff, right? It can lead to physical violence. but it really magnified the harms of domestic violence and the trauma due to domestic violence, and also created new forms of abuse. So this is countering that misconception that if it's not physical, it's not that bad or it doesn't have an impact. So in response to our interviews that we did about women's experiences of technology-facilitated coercive control, we had a number of recommendations around education, assistance, resources, and regulation. So as far as education, the participants recommended education for the telecommunication companies like Telstra and Optus so that they understand the issues that domestic violence survivors might have if they're in an abusive relationship or trying to separate from an abusive partner, for students at universities like Griffith, for courts so that the court staff understand the implications of technology-facilitated abuse, and also so that they can become clear about the types of technologies involved and the risks that may be involved, especially as family courts like to recommend FaceTime and other types of technology facilitated communication between abusive parents and their children post-separation. They also wanted education for the police and for the platforms so that they could work on preventing violence in advance by design. As far as assistance goes, survivors wanted replacement devices, phone and data credit. They needed in-person hands-on security checks where you can hand your device to another person and they can help you walk through checking and changing your settings. And this is really important because when you're in the midst of trauma, it's very difficult to follow a 40-step complicated checklist that never seems to match up with what your device actually looks like. In addition, people in rural and remote areas really just needed reliable mobile service. As far as resources go, survivors asked for assistance with checking privacy settings, contacting corporations, investigating crimes, and changing and unlisting their numbers. And finally, as far as regulation, survivors asked for better information across the board for consumers so they know the privacy risk involved in the devices and platforms they're using. They wanted some hardship assistance, like it's now available for certain utilities in Australia. They wanted some clear mechanisms for reporting and monitoring platforms and progress dealing with technology-facilitated abuse. And they wanted some regulations around preventing hidden tracking by default with the programs. And I have no idea what time it is because my clock disappeared when I shared my slides.
You're okay. You've got 6 minutes.
Oh, I totally went too fast. So for more information about this study, the full report and infographics are posted online. There's a number of articles that are taking forever under review at the moment, so eventually those will be published as well. But also I wanted to draw your attention to the ACAN grants. And these are grants that fund projects to enable research on telecommunication issues for consumers. And these are fantastic grants. They have a very short application, which I really appreciate, and you may as well. They're very comfortable in the $50,000, $60,000 range, but the grants go all the way up to about $100,000. And there's an annual round on a predictable timetable, which personally I appreciate. The next round that's open is in 2021, and it'll open in February for projects that start in July. So if you have any questions about the ACAN funding source, feel free to talk to me about that. But the only other thing that I would like to say about ACAN is they're happy to discuss your project with you before you apply, so you can get a feel for if they're interested in the project that you want to work on or not, which I think is also great as far as not wasting more of our time the way so many grant applications do. So I'm happy to answer any questions that anyone might have.
So our next speaker is Outi Donovan, who's from the School of Government and International Relations. Outi, I think, managed to arrive here just before the really crazy quarantine sort of situation that Alexis was talking about last week, but it's still been quite a year. I think it's fair to say for my colleague, and we're really lucky to have Outi here speaking with us today. So her research career has been devoted to identifying the political conditions that deny humans access to civil, economic, and social human rights. And her research focuses on situations where humans face immense vulnerability, including disease outbreak events, gender-based and sexual violence and conflict, and forced displacement. So we're kind of like intellectual sisters of another mother, pretty much. So it's a real pleasure for me to talk to you, to introduce Outi's topic on conflict, gender, and COVID-19, exploring the intersections. Outi is going to be looking at the gendered impact of COVID-19 in societies affected by armed conflict. And her discussion will draw on an initial review of the patterns and trends across conflict-affected societies with a specific focus on the different types of insecurities that are emerging from the collision of conflicts and coronavirus pandemic. Thank you so much.
Hey, thanks, Sarah. Let me just see if this works. There we go. Okay, you can see my slides, right?
Yes, thank you.
And perfect. Okay. All right. So thanks again for the opportunity to talk to you today about my research on conflict, gender, and COVID-19. It's probably useful to start off with a couple sort of words about my own background. Well, Sarah talked about it already, but also the background of this work that I'm currently doing. So as Sarah mentioned, my research revolves around all things to do with conflict, what happens after conflicts, and how does gender play into those processes. This is first time that I'm working on pandemic. I'm obviously not a health scholar. I'm not even a health policy scholar. So my interest on the ongoing pandemic is really from sort of political, sociological perspective. This current work is work that's related to or builds towards an ARC grant that I'm hoping to submit next year. And what I'm currently doing is writing initial background paper and really sort of conducting initial desk-based research to try to understand some of those intersections. What are some of the common patterns and themes that we're seeing across a range of conflict-affected societies or societies that are just emerging out of armed conflicts. So, as I'm sure most of you are aware, there's quite a bit of research or commentary about the gendered impacts of COVID-19 around the world. But we still know less about the effects of the virus on conflict-affected societies. There are some think tank reports that have been published in the past couple of months that sort of look at COVID-19 in the humanitarian context. But those reports generally ignore or overlook gender in any meaningful way. So my main sort of initial question, my main sort of research question at this point is, well, what happens when armed conflicts intersect, when they collide with major disease pandemics such as COVID-19, and what is the experience of this dual crisis of armed conflict and the coronavirus outbreak from the perspective of gender? Now, there is previous research that looks at pandemics in humanitarian contexts, but what we are experiencing currently is unprecedented in many different ways. So, for example, as far as I know, the Ebola outbreak in Western Africa, for example, while it had impact on humanitarian access, on peace building efforts, it didn't represent such sort of similar wholesale disruption that COVID-19 is currently posing on peacemaking humanitarian activities in conflict-affected societies. Why the specific focus on gender? Well, I don't think I have to justify this particular focus too much for today's audience. We of course know that crises, whether we're talking about wars, whether we're talking about pandemics, economic crisis, natural disasters, they're of course deeply gendered, and it's really important to understand the different experiences and the different impacts that crises such as conflicts and pandemics have on women, girls, boys, men, non-binary populations in order to build back better. So to build societies following these crises in a way that is more inclusive, in a way that addresses some of the root causes of crisis. Now, in this initial round of research, I'm focusing specifically on women and girls. And that's not because I think that men and boys and non-binary populations are somehow less important. I'm focusing here on women and girls because they are disproportionately affected by the dual crisis of armed conflict and COVID-19. In terms of non-binary populations, I think there's a lot of interesting questions, a lot of interesting work that could be done. Unfortunately, I haven't managed to find at this point a lot of research material, secondary sources that I could use in this initial round. But this is something that I'm interested in exploring in the actual project. So as I mentioned before, the purpose of this research is just to provide an initial overview of this intersection of armed conflict, the coronavirus outbreak, and gender. The pandemic, of course, is still ongoing. The situation is in flux, but this is just really to try to understand what are some of the common patterns and themes that are emerging. In terms of research material, I'm using secondary sources, so country-specific survey reports by human rights and women's rights organizations. So, what are then the initial findings? Well, what is evident at this point is that the dual crisis of armed conflicts and COVID-19 are creating new and exacerbating existing insecurities, and I'll come back to this point in a minute. But what's really important is that these different types of insecurities disproportionately affect women and children and marginalized populations because of a number of gendered vulnerability multipliers. The vulnerability multipliers refers to societal structures, socioeconomic conditions that undermine the ability of certain groups in society to protect themselves against crises, or when crises happen, to manage them. And in the context of conflict-affected societies, some of the key gendered vulnerability multipliers are restrictive gender norms, gendered division of labor, and lack of access to resources. I'm very conscious of the time, so I'm happy to talk about this a little bit more afterwards if you're interested. But the key point really here is that these sort of, in many ways, these vulnerability multipliers essentially form the backdrop for this dual crisis of armed conflict and COVID-19, and to a large degree shape the ability of individuals and groups to respond to it. So as I mentioned before, the initial review really across these conflict-affected societies is that a range of insecurities new insecurities are emerging, or existing insecurities are being intensified. And one of the main insecurities is physical. So there's been a fair amount of commentary lately about the shadow pandemic, how COVID-19 has essentially sparked increase in domestic violence. And this is also what we see in conflict-affected societies, or anecdotal evidence seems to suggest that there's been increase in sort of private violence, if you like. But what conflict-affected societies have also experienced is spikes or increase, escalation in sort of public violence, if you like. So the pandemic has provided opportunities for conflict actors, whether governments or sub-state armed groups, to intensify violence. And this, of course, has a number of implications, particularly for women and children. This causes further displacement, which in turn results in a range of different insecurities. So, for example, we know that refugee camps, they're quite dangerous places to be, particularly for women and children. They're vulnerable to exploitation, to various health and economic issues. Another type of insecurity that we're seeing is economic insecurity. In conflict-affected societies, the same way as in the rest of the world, it is women's livelihoods that are hit hardest by the pandemic and the responses to the pandemic. What's very specific about conflict-affected societies is that a large number of households are female-led, and this has really increased the hardship that these households are under at the moment, and increased the rates of food insecurity in many conflict-affected societies in a very, very dramatic way. Again, this sort of leads into compounding crises, compounding insecurities. So, for example, in situations of food insecurity, families, for example, tend to pull their kids out of school. They tend to marry their girls early in order to reduce the number of mouths to feed, and so on. Another type of insecurity that is very evident in many of these conflict-affected societies is political or representational insecurity. Women are significantly underrepresented in decision-making structures on COVID-19. But what's particularly notable is that women are further excluded from political processes in these conflict-affected societies. These talks, most notably, have moved to the online environment. And on the one hand, this provides an opportunity to increase women's participation, because they don't actually have to leave their houses and face some of the physical insecurities that they may face in order to get to the negotiation venue. But of course, the reality is that the gender digital divide means that women have much less access to the internet, mobile phones, the relevant technology, and they're even further excluded from these very important political processes. Then finally, there are health and social psychological insecurities. There are a lot of things I could discuss here, but just a couple of quick points here. Civil society organizations in operating in these conflict-affected societies are reporting stigmatization of women. So, for example, it seems to be a very common experience that if women are infected by the virus, it is seen as being the women have done something wrong. Whereas if men are infected, they just generally get sympathy, and it's not their fault. And this can have quite significant implications to women. It can cause reputational damage to women, and it can have negative effect on women's ability to get married. Of course, for women to be able to get married in many of these societies is hugely important in terms of their economic and physical security. Another very important point is lack of access to social networks. Women and girls in particular in conflict-affected societies often rely on social networks for informal job opportunities, for credit, even for things like counseling. And of course, because of societal lockdowns, stay-at-home orders, women have much less access to these networks. So these are some of the insecurities that are that are very evident really across the board of looking at these conflict-affected societies. And from the gender or feminist perspective, these type of insecurities aren't necessarily particularly surprising. But what I think is really, really important here is to sort of recognize and acknowledge the fact that these insecurities and the intersection, the dual crisis of armed conflict and the coronavirus outbreak, they're causing insecurities and forms of violence that go way beyond just simple physical violence. The impact of these insecurities, of course, is deeply uneven. So not all women and not all girls are impacted the same way. Minorities in particular, displaced individuals and refugees are often worst affected. What's really important here is access to resources. So those who can actually access resources, like credit, for example, are in much better position to try to mitigate some of these gendered insecurities. One final thing I wanted to highlight, and it's hugely important pattern that is emerging out of these cases. We're seeing evidence of increasing turn towards adverse coping strategies. Sort of more proactive coping strategies like migration, for example, is of course out of question at the moment. Many host countries have completely suspended their migration processes and systems. So many families and individuals in these conflict-affected societies are increasingly resorting to coping strategies such as child marriage, child labor, joining armed groups, limiting food intake, of course, something that impacts women in particular because of the norm that women eat least and last. We're seeing increasing instances, increasing numbers of transactional sex. And of course, needless to say that these adverse coping strategies then further exacerbate the various insecurities that I have so far identified. I think I may have gone slightly over time, so I'm going to leave it here. Thank you.